All right, you're watching TVC Breakfast. Now let's get into our next discussion now. The Nigerian Medical Association has issued a 21-day ultimatum to the federal government to resolve all lingering industrial actions with the National Association of Resident Doctors, Medical and Dental Consultants Association of Nigeria, and other affiliate members. This ultimatum is part of the resolutions reached during its National Executive Council meeting held in Benin City. According to the NMA, in the event that the federal government fails to implement the agreements after the expiration of the 21-day ultimatum notice, NMA shall summon an emergency delegate meeting to review the progress made on the implementation of the agreements. The NMA insists that no doctor shall be victimized for participating or not participating in the strike action by NARD. So that's the basis of our discussion right now. We'll be talking about this. And in the swift reaction, the Ministry of Labor and Employment has said the 21-day ultimatum given to the federal government by the Nigerian Medical Association is in direct collision with the Memorandum of Understanding signed on the 21st of August 2021. The statement released by the spokesman of the ministry, Charles Akpan, said, and I quote, the federal government is religiously implementing its own side of the agreement with effective monitoring by the Office of the Minister of Labor and Employment. But the NMA is yet to move a needle on the rules assigned to it in the agreement. The government argued that the NMA's position is at variance with the timeline stated in the Memorandum of Agreement, as the technical committee set up to tackle the backlog of arrears was given 4 weeks effective August 31st to round off its assignments. The government admonished the NMA to play its role as the guardian of its affiliate associations instead of descending into the arena for needless fear of impeachment. All right, these are some of the issues we were talking about. Joining me to discuss this is Executive Director, Health Emergency Initiative, Pascal Achinine. It's nice to have you join me this morning.
Thank you for having me.
Great.
Good morning, Nigerians.
You're welcome.
Good morning, Lagos.
Good morning. And I also have on Zoom President, Commonwealth Medical Association and Policy Analyst, Dr. Osaho Nabulele. Dr. Nabulele, good morning. It's good to have you join me now.
Thank you, Mike. It's been a long time.
Yeah, exactly. It's been a long time, but it's good to have you.
Good morning.
Right. Now, let me start with you, Dr. Nabulele, on this. I know you've been following this development, and you have been president of these unions at different levels and all of that. What do you make of this face-off between the doctors' union and the government, especially when it comes to not understanding or misunderstanding or misrepresenting industrial court resolutions and all of that? Can you unravel some of the issues for us?
Well, thank you very much, Mike. Good morning, Nigerians. I must say, as a Nigerian, I feel very, very sad, that we are in this kind of situation. And more worrisome is the fact that it's become like an eternal triangle, a perpetual struggle to get some things, done rightly within the health landscape of Nigeria. I might perhaps still need to up their game, in terms of their capacity, to address issues that are very germane. Rather than resorting to self-help, or other means that may conduce to strong arm tactics to suppress legitimate struggles. So rather than issue out very uncharitable statements, I would have thought that they would, in a very sober manner, embrace, negotiable courses and see how these things can be quickly very bourgeois prescriptions that do not really help in the resolution of this face-off. So, like I said, worrisome is the fact that these issues have always been.
All right, Dr. Nabulele, we're finding it difficult to hear you clearly because of the audio network from your end. But I'll come back to you shortly so we see if that is fixed. Now, Pascal, let me come to you on this. The point there is, when it comes to government and doctors' union or medical unions, this is not the first, second, third, fourth, or even 10th time strike of this kind is going on. But one would expect that after so many years, some of the germane issues in the medical profession should have been, decided by government. Let's handle this for the sake of the sanity of the health or medical or health sector, as the case may be. What do you make of this?
It's depressing and heartbreaking that we are still going around the circles. This strike by resident doctors started 4 weeks ago on the 2nd of August. 4 good weeks have passed. And we need to put some things in perspective. The resident doctors constitute about 75 to 80% of the medical corps of doctors in Nigeria. So that means that number, and is nationwide, has not been rendering service within that period. Indeed, as the beginning of this month, the fatalities from cholera was about 600. Now it's over 2,000. That tells you the implications of this.
And the consequences.
And tragically, everybody thought that after COVID hit us last year, most countries stepped up their game in improving their health systems, increasing allocation, ensuring stability,
and different budgets.
Budgets, budgetary allocation. But here, of course, we had less than about 6% this year. If you also go in most communities, in most nations, more attention was paid to the welfare of doctors and health workers in general. But here, we just there was an industrial dispute action sometime in that was just called off in March. Another one that you expect that after several stakeholders got involved in resolving that issue, we won't go back to this too soon. You ask a very important question: how long shall we do this firefighting? Because there's even no time of coming together of stakeholders. For 1, 2, 3 years, we have relative stability, and let's plan holistically on how to change the health sector narrative. Right now, there's strike today, there's strike tomorrow. And of course, some of the issues that are very obvious to us. If currently, and I just want to align with what the NMA is saying, that they've given 21 days notice. And of course, there are regulations that governs industrial action. So they are trying to comply with it. But you put it in perspective, for 4 weeks now, people that are averagely above 40 plus, because most consultants who are currently in the hospitals, they are older than the resident doctors. Typically should be so. And there have been so many things that happened all this while, besides COVID-19 and this Delta variant and the fatalities and the increase in number of infections. We recognize that once an industrial action commenced by resident doctors, more than, among other things, many patients will be asked, will be discharged, appointments will be cancelled, over 80% of Nigerians will be unable to access care. So we bring it back to decision makers. Why are we not touched? Are we not moved to see Nigerians die? Have we got to such a level that the lives of Nigerians don't matter to anybody? And I saw that through about a fortnight ago, there was an 11th hour meeting mandated by the president. And the president asked that all technicalities be dismantled for a prompt resolution to this. I expected that there will be a closure by last week on this strike issue. But we are still going around the circles. And it's not helpful to give threats. This is not a time to issue threats. It's a time to, this is our limited resources. So I'm just emphasizing this part, that this is our limited resources. These are our constraints. Can we, out of 10 items, let's fix 4, let's fix 7.
And set a time frame to fix the remaining
and
one.
Also put machinery so that we will not default on those ones you have.
All right. Let me bring Dr. Nabulele here. Now, this 21-day ultimatum by NMA to the federal government, a lot of people are saying that if that happens, it's going to complicate or compound the whole issue, the medical issue so far. Sitting down from your perspective, I wonder what engagement you're having with the NMA when it comes to the consequences of this on Nigerians and the patients who need medical care and who will badly need medical care at this time.
Yeah, thank you very much, Mike. I must say that the NMA, as a responsible body, is only trying to step up the game of the federal government and its agents to do the needful, working within a time frame, rather than this eternal triangle that we've always been seeing in terms of the several agreements that have been signed. So it's like giving another opportunity to the agents of government to step up their game, to press on the gas, and ensure that all what they have committed themselves to are brought to a note of, addressed with a note of finality. You know, so I think NMA should be commended for coming in to see how they can, you know, make it a bit more frenetic and a bit more, you know, conclusive by, of course, advancing a window period for government to, of course, redeem, you know, its trust, you know, quotient, you know, and, of course, get people to understand and appreciate that perhaps they are really interested in saving Nigerians from the untoward effects of a total shutdown of the system, because nobody wants to hear of an NMA strike, you know, and I do not think that is the wish of the association just now. They are trying to see how they can create, you know, greater opportunities and space for government agents to, again, you know, prove to Nigerians, not just the medical professionals, but to Nigerians, that they are sincere and committed towards addressing the several, you know, perennial issues that are still yet to be resolved. So I think NMA should be commended for stepping in to see how they can get government to, you know, lift up its own tempo and get more committed to the issues on the table.
All right, and Dr. Nabule, let me stay with you on this. The point there is, if we have to commend NMA for stepping in, and eventually something happens or nothing happens until the 21-day ultimatum expires and they have to go on strike, a lot of people, wouldn't they see NMA as being insensitive? Because this strike is not necessarily concerning the NMA directly. They are just in solidarity as a way of, you know, showing concern with others. What do you say about that?
Well, thank you very much. I think we are still in the early days, and rising from the National Executive Council meeting of the Nigerian Medical Association, we just had the last few days. So I think these are early days, and days that will actually determine, you know, the days ahead. So the earlier these issues are engaged, the better. I do not think we should begin to think of the worst case scenario right now, because it is not a wish of Nigerian doctors to get to that level. You know, the opportunities are still there now. We believe that rather than wait the last minute, government should embrace this opportunity quickly and make sure that Nigerians do not suffer more from whatever crisis, you know, will emerge at the end of that timeline that has been given by Nigerian Medical Association. So it's a large window, and any sincere, committed government will see it as an opportunity to quickly address the issues. Don't forget that these issues have been on ground. So if you sign MOUs, if you sign MOAs, if you sign motors and several other, you know, contractions, you know, which conduce to which they say are agreements, then this is now a new opportunity, you know, that has been opened up. So get to the table and drop all the, you know, very negative, retrogressive, you know, strong-arm practice, you know, that has been used in the past couple of days to see how they can oppress or suppress a legitimate struggle, to say, look, we are now open to more better negotiations. We've improved our negotiation skills. We are no longer emotional about this. We are now altruistic and patriotic, so that Nigerians can see that we mean well for them. We care for the health of Nigerians. And I think all players should be on board, from the Federal Ministry of Health, from the Office of the Head of Service, from the Ministry of Labor. Everybody should show some greater altruism and greater patriotism, rather than, being standoffish, about this whole, issues on the table. Nigerians want to see an end to this perennial, struggle, to go get things better for them in terms of their health. Because ultimately, really, what the doctors are fighting for will eventually result in better, healthcare arrangements, better healthcare for Nigerians in whatever ramification you look at it. It may not be, it may not be, what we eventually, ultimately want, but some movement in the right direction will be made if all these issues are given some level of serious commitment in terms of addressing them.
All right. Dr. Namulele, I'll come back to you on the issue of brain drain following a report of Saudi Arabia recruiting Nigerian doctors. I'll come back to you shortly on that. But Pascal, let me come to you. The point there is, when it comes to this engagement that we talk about, the ideal way of engagement in such a way that there is a win-win situation where it is the medical or the health sector is the one who wins. The Nigerian patient or Nigerian who needs medical services is the one who wins. What kind of engagement would you really look at from the ideal perspective between the NMA and government?
First is that government approach should take a human face. And it will also reflect their body language in terms of what they do outside the health sector, how they spend resources, whether on personal or national level, must reflect that there's judicious deployment of resources. So that once the picture is painted to stakeholders that the leaders are conducting themselves in a resilient manner when it comes to utilizing national resources, that alone is a huge statement. Then on the part of the stakeholders, especially the health workers, particularly the doctors here, I canvassed that position some times ago, that if you have 10 items and the government meets you in the middle somewhere, you can concede for the sake of Nigerians. The ultimate loser, the ultimate victim is the average Nigerian who is unable to afford health care in a private medical system. But even at that, we must also put it in perspective. There are certain services that the private hospitals cannot provide that a teaching hospital has capacity and manpower to do. So I think the first important aspect is that government must make up its mind that, okay, this thing, let's fix it in 48 hours. Let's not get to the stage where it gets out of hand. He has indicated that NMA will take XYZ action. But I also want to call on some other stakeholders. Where is NLC in all of this? Where is NUPENG? It's not from the standpoint of going on industrial action, but they can be part of the engagement with government. That will exert a little more pressure. And we also saw that the National Assembly, especially House of Reps, in the last dispensation when there was an industrial action, they came in strong. Even though they are on recess, the country's health system is burning. We must do something, not just wait until 21 days is due, but do it now to avert more deaths. There are lives being lost daily. I got reports yesterday, and because our organization supports indigent patients, and most of them are unable to go to the hospital because the consultants are only handling emergency cases, especially patients that were already in the hospital. So Nigerians are dying in their large numbers. Government, please, we appeal to you, give this a human face and treat it expeditiously. Nigeria Labour Congress, you are the umbrella of all workers, and most of their own children and relatives and themselves access care in public hospital. We can't be indifferent to this, not from the standpoint of going on strike, as I say, but let them be part of the conversation.
The mediation process.
Yeah, the mediation process.
Okay. Dr. Onabulele, let me come to you now. Recently, the report of Saudi Arabia making arrangement to recruit Nigerian doctors en masse in Abuja. The videos went viral. The news went all over the place, and Nigerians were complaining you know, and others were, of course, if the system is not functional, what do you expect? And there was also a report credited to the Minister of Labor when he was asked concerning this, and he said, of course, we have enough doctors, we're just exporting and all of that. What do you make of that development, though?
Well, again, it's another feature that indicates that all is not well with our health system, and of course, our Nigerian states generally, not just the health system, you know, and so people are trying to see how they can, you know, survive in more saner climes, you know, and this is what you are saying, because in Nigeria today, you find out that there is no Nigerian that is not challenged with, you know, the issues of the socio-economic disequilibrium, if you like, including issues of security, insecurity, which has really challenged Nigerians. I mean, every day, no Nigerian wakes up feeling relieved or feeling secured. And so when you find opportunities elsewhere that perhaps will guarantee your security and, of course, your, you know, socio-economic state, you may want to, of course, concede to the alluring tendencies of those who are coming to recruit you. For the medical professionals, again, it boils down to the issues we've been talking before now, that the issues that have been challenging them have remained unresolved. And so there is a level to which somebody can tolerate such inanities. And when the working conditions are not appropriate, when, of course, the ambience, you know, within which he has to, of course, you know, undertake a sacred responsibility is not guaranteed, when issues of insecurity is still rising on a daily basis, what do you expect such professionals to do? I mean, you have over 8,000 Nigerian doctors currently registered on the General Medical Council registry, and a lot more in other countries. So you do not blame those who are moving. Rather, what the Nigerian government ought to do, like I've counseled them several times, is to address what we call the push factors preeminently. You know, because you have the push and pull factors in this whole, you know, contention. You know, you have to address those ones, primarily those conditions in your country that are making people to vote with their feet on a daily basis. So what are the working conditions for the medical professionals? How good are they? Can we move from where we are now to a place where we can say, okay, we are almost getting to where other countries are in terms of the working arrangements? What are they, you know, what are the wages like? In this country today, you still have doctors who are owed close to 19 months' salary. I mean, the same with other health workers. So what are you telling them? That they should continue to, of course, tell stories to their families who they have to feed on a daily basis? There are state governments, for instance, that are owing doctors 10 months, 19 months, 6 months, 4 months. What stories do you want them to tell to their families who look up to their breadwinner, for instance, to provide bread on the table? And yet you have a government that comes to say, look, we are ready to pay you 10, 20 times what you are currently earning. I mean, the law of survival, you know, suggests that, look, such individuals, no matter their patriotic level, will, of course, be attracted by such alluring schemes. So it is for the Nigerian government to sit down and reflect on all those factors we have since itemized since 2004, if not before that, to say, look, can we patriotically, committedly, and altruistically begin to address these issues such that those who are even moving now will move back to Nigeria, and even other professionals from other countries may even want to come into Nigeria to practice because of the fact that we now have either an equipoise in terms of what obtains in Nigeria, the balance between what obtains in Nigeria and those other economies or countries. And of course, even better, why can't Nigeria even be better than those economies of those countries? So I think the earlier these issues are soberly reflected on and addressed, the better for our healthcare industry, because it is affecting the health system in all ramifications. Things are no longer the same. Now you have both the old and the young moving out of the country. Like I said, in the register of the GMC, as of today, there are over 8,000 Nigerian doctors registered, not to talk of those ones who are not yet on the register. In Canada, in UK, in the United States of America, in Saudi Arabia that we're talking about now, even in Gambia and some other African countries, Nigerian professionals are moving.
All right.
Because man naturally will want an environment that is comfortable for him to of course survive, and
All
of course supply is trade or profession.
Okay. Thank you very much, Dr. Osahoyan Abulele. Now, Pascal would like to react to that just briefly in 30 seconds. Saudi Arabia government looking for, recruiting medical doctors in Nigeria.
We saw there were some reactionary measures by some people in government. Is about doing a soul searching. How can we constructively bring this to a stop or minimize it? Because not all of us can relocate outside the country, so we still have this country to preserve. And there are still some doctors who are patriotically willing to serve. So you can design policy programs. You can part of it should even be addressing the current crisis. It would give room for more Nigerians, for qualified doctors, to stay back and fix this country.
All right. Thank you very much, Pascal Achinine, for coming on the program.
It's my pleasure.
Dr. Osahoyan Abulele, thank you so much for joining us on the program this morning as well.
Yeah, thank you very much. Thank you.